Hello, this is Dr. Jazayuri. This is my Corona update number 8, coronavirus update number 8. For those of you who have been following me, you're probably wondering what's all this stuff on my face. No, I don't have Kaposi sarcoma. I just had some free time, so I'm trying to feed some of these age spots that I have. Now, if you notice, I'm going tangent, but this is hopefully will help you out. If you notice this side of my face, I have a lot more age spots. I have almost none on this side. And the reason is when I'm driving, the sun hits this side of my face. And when I was younger, now I put sunblock and I bring that visor and I flip it. So, it's covering my face. So there's proof for you that sun is not good for your skin. So, listen to your dermatologist and plastic surgeon. The cheapest plastic surgery you can do on your face is don't go in the sun too much and don't smoke. But getting back on the freeway, there's a lot of stuff to talk about. So, I have a list here. Sorry if I look down. So, good news, the CDC, and I have to say the CDC, I really commend them because from the beginning, they have presented things in a very neutral, just practical way, just stating facts. From the beginning, the CDC always said that this disease causes mild or no symptoms in most individuals, and the patients at high risk are the older population. This has been true. And so, they've always just talked about things in a very neutral way, whereas the NIH, Dr. Fauci is the director, they're always kind of more bleak and darker. But so anyhow, both CDC and the NIH, Dr. Fauci now are saying that the projected number of deaths is not as high. I think Dr. Fauci's projection was 100,000 to 200,000. Now they've dropped it to around 60,000. Again, this is because of social distancing. So, don't start going out. The freeways are getting busier, and I'm getting worried. We're not there yet. And if we want to stop this and nip it in the bud now. If this drags and the economy goes into a recession, we're in all kinds of problems. So we're not done yet. I know in Orange County, a lot of cities have said that all the public places are shut down until May 3rd. That's great. I personally think we should go until end of May, and I've talked to you about that, just to be really on the safe side. So that's good news. Social distancing is working. Thank you, all of you. I hope you keep it up. I wanted to also talk to you about, again, I've talked to you about Germany. The death rate in that country has always been much lower. And it's gone up a little bit as some of the older population have contracted the coronavirus, but it's still 1.6%, which is second only to South Korea, which was 1.8%. So people are looking into that. According to the German experts, and initially this apparently started spreading among the ski resorts, and this article is from New York Post, by the way. And so these were all young, healthy patients, but also they have a very aggressive screening process. They actually, at least in the city of Heidelberg, for example, they have taxis driving around, and anybody who seems to be coughing or sneezing, they actually go, kind of like that Fashion Emergency show. Remember, they used to grab people from the street and put them in a van and make them up. So they examine these patients. The people would get out all protected, and even if you're not sick, they say, hey, I think we think from what we're seeing, you should go to the hospital, and they test extensively. So good for them. Now Germany is a much smaller country. Korea is much smaller too. I don't know if that's possible in our big country, and we have a huge country. But nevertheless, we were not prepared. We did not do very well with this pandemic. The Trump administration was told about this in beginning of January, that there's something brewing in China. So hopefully we'll learn from our mistakes for next time. But that's, so Germany's approach has worked. I also wanted to talk to you about some of the possible, well, I don't want to call it cure, treatments. The first thing I want to talk to you about is this thing, the malarial drug, hydroxychloroquine, chloroquine. You know, a lot of people got excited. President Trump said this is a treatment for it. You know, nobody, that CDC, the NIH, the Society of there's a society of microbiologists, and I can't remember the exact name. All of them have said that this is suggestive. We cannot recommend this medication yet. There's not enough data. What scares me is, you know, I'm a member of the American Society of Plastic Surgeons, and we all have to be board certified to be a member of it. And we have the app, you know, that I have on my phone. We have discussion groups, and every time there's a new answer or comment in a discussion group, I get to read it. You know, it comes up. And there's doctors now that said, yeah, this drug works, and I have started taking it prophylactically. I mean, you know, this drug is not to be taken lightly. It is has an extremely dangerous side effect. It's called, and one of the side effects is prolongs the QT of your heart. And so you can go into a rhythm which is called torsade de pointe. So that means you get a peak, and then it goes to a point, and you didn't get a peak, and it just keeps repeating. Okay, and this is a deadly rhythm. The mortality is extremely high. So it baffles me why even educated people are just, you know, again, panic. You know, anxiety, panic is taking over a reason. So please, you know, do not take this medication, okay? But some of the exciting things that are going on is they're looking at getting plasma from patients who were exposed to the coronavirus. So they already have antibodies formed to the virus, and then they can, you know, clean the plasma where they need to do and inject it into other people. The other option, which is more efficacious, is to, again, get the plasma, extract the antibody, and then synthesize it so you can mass produce it. They're thinking of doing that in patients that are sick, because the good thing with this treatment is obviously the antibodies are right there. So it's like an antibiotic. You get an infection, you take the antibiotic is right there. The problem is once we stop the treatment, the effect is gone. It's just like, again, antibiotic. So good thing is immediate protection. The bad thing is it's not permanent. So the gold standard, the prize is still getting the vaccine, but it may be a year away. So they're looking at some options to at least try to help some of these people who are getting ill. The other thing that is exciting is there's a receptor called the ACE2 receptor. And the ACE2 receptor exists in the lungs, the GI tract, and the kidneys. And that's why some of the people who get the coronavirus get not only respiratory, but some of these urinary and GI symptoms. And so if you look, and the ACE, this is the same ACE that, you know, when we give an ACE inhibitor to control a blood pressure, somebody has hypertension, it's the same, you know, it's the same family. So the virus, if you look, I'm sure you've seen the photo of it a million times, it has these spikes, and some of these spikes have the same, they fit into the ACE2 receptor, so they come like this and they fit in there. That's on the lungs. So what does the side effect of that is that the lung then cannot produce surfactant. Surfactant is basically a soapy film. So if you think about your lung, it's constantly expanding to bring in oxygen and contracting, right? Getting rid of CO2, expand, contract. And it does that throughout our life. So it needs to have some slippery surface, right? You can't have a dry balloon keep doing that over and over. So this virus then, when it attaches to the ACE2 receptor, it prevents the production of surfactant, and the lung gets stiff, and that's where we get these problems, you know, the acute respiratory distress syndrome. So they're working on making a drug that mimics the ACE2 receptor. So the ACE2 receptor, this fake um, uh, medication then sticks to the ACE2 receptor, so the virus can't attach to it and then do its own thing. So the virus, I wasn't quite clear. So the virus attaches to the ACE2 receptor, allows the virus to inject this DNA material into the cell, and then when the virus replicates and comes out, the cell bursts, right? And the cell death that prevents the production of surfactant. So I wasn't clear on that. So this medication then comes and sticks to the ACE2 receptor, so the virus then cannot stick and it just floats into your body and eventually dies. So that's very exciting. We'll see what happens with that. And then, the other issues that I wanted to talk to you about is, I was trying to guesstimate like how many people in the United States may be infected. So last year, there were 19 million people that were infected in the United States. With the death rate for the flu is about 0.1%. So if 1,000 people get the flu, one person dies. I think 2% is pretty reasonable. So if you divide the 19 million by 3, you get about 6.5 million people. And it may be even higher. But let's say 6.5 million people in the United States have the coronavirus out of 330 million. So if the projected death rate now is 60,000, that comes to about 1%, which, if you remember, was the death rate in the Diamond cruise, in the Diamond Princess cruise, where the good thing with that cruise was that we were able to test everybody, so we knew exactly how many people got the virus, and then how many people died. Right now the death rate again is between 5 and 6% globally. But I'm sure it's less because there are a lot of patients who are asymptomatic. But even at 1%, remember, it's still 10 times higher than the flu. So, we should still continue with social distancing. But, I wanted to talk to you about some of the issues that have come up because of this coronavirus. And again, to give you a prelude, I listen to NPR, National Public Radio, a lot. And maybe a year ago or a few months ago, they were talking about the concern with our education system in this country, in the United States. And, sure, we all know, when it comes to math and physics and all that we are weaker than other countries. But this was something they brought out that was really interesting. And this was around, maybe it was more than a year, because it was around the time there was all this concern about the Russian interference with the elections and how they manipulated the population. So they gave a bunch of reading material to people of in different countries to read, and these were people in college and in middle school or high school, and then they asked them questions, what their deduction was from these articles. And the American students did very poorly. And so the concern, in this discussion was that as a nation, if we create this type of, education pattern, that we as a nation will be much easier to allow manipulation of our thought process, because we cannot deduce the data properly. And that really hit me hard. And then, this thing had happened with the election. So, I've been trying to find this video. My wife showed it to me. It's like a conspiracy. Well, they didn't call it a conspiracy, but they said, we'll show you the facts and you decide whether China made this virus or not. And again, I have nothing to do with the Chinese government. I'm actually happy that there's a backlash against them, because we've had 3 pandemics over the past 17 years from China. 2003 we had SARS, 2009 the swine flu, and now this one. And so I'm hoping now that China is more integrated globally, in a business fashion, that hopefully they realize they just have to do something about this. But again, it makes me angry when people don't look at things scientifically. So this is a very professional quality video, and again, I could not find the link, and YouTube, and I couldn't find it. But it's an Indian, attractive Indian newscaster. I don't know who she is, but she's talking about, she's showing you things, and then is telling you, then you decide if this is a conspiracy or not. And it's gone all over, and these things have gone all over. So one of the things was that, that China was able to contain this, this virus so quickly. And I'll tell you the list, and I'll talk about it. The other thing that they said, that the Chinese president went to visit Wuhan with just a mask, and how come? Because he was already vaccinated. He should have gone in a space suit or some kind of protective gathering. The third thing they talked about is that the stock market in China barely dipped at all, and so because they already have planned this. Some of the other things, now this may not have been from this video, but other people have talked about that Russia and North Korea never reported any cases because they already had the vaccine, because they're all in it together with China. What was the other one? So I think those were the main ones. No, I did talk. Okay, so talking about how China was able to contain this virus. Well, remember, China, first of all, they've had pandemics before. I'm sure they have they're better prepared than us. And you have to realize China is a communist country. There are a lot of bad things with a communist regime, but they are very effective in controlling things and putting things down. Riots, infections, this and that, and they will do whatever it takes because they don't want their image to be tarnished. And I mean whatever it takes to control, anything like this. So I'm not surprised that they were able to contain this so quickly. Again, going with the other thing with the president of China wearing a mask, well, again, you have to, if you think like a Chinese government or a communist government, going out with a spacesuit is scary. It scares people, it worries people. I can almost guarantee you that was staged. I don't even think he went to Wuhan. He probably just did it in Beijing wearing a mask, and he was just around pretending to be in Wuhan. Or if he was there, it was after it was contained. To me, that was already staged because their image is extremely important to them. Regarding the stock market, if you ask any economist, a government like China, which controls everything, investors love that because their stock market is very predictable. Things don't change. So, and you can look up. I mean, this has been discussed in NPR, for example. So I'm not concerned. I'm not surprised that their stock market didn't move too much. The other thing was, how come Russia and North Korea didn't report any? Well, North Korea doesn't report anything. Why would you conclude that? It's a closed country that doesn't want to say anything bad about themselves. Russia, for the longest time, again, it's very similar to China. They don't call themselves communists, but I mean they act the same almost. Russia for the longest time said that they had no HIV or AIDS cases, and finally they had to admit. So none of these surprises me. But, if you want to look at conspiracy theory, again, this video is very professionally made, very high quality. There's an attractive newscaster with an Indian accent. Well, my conspiracy theory is that the Indian government made this video to badmouth China so they can get business from them. I mean, you know, you know, you didn't see that coming, did you? So, you know, when people feed you information, you know, make sure you chew it, and if it doesn't taste good, spit it out. Don't just swallow it and accept everything I say. Now, you know, I'm not saying I know everything, but you know, you have to analyze things using the correct sources, and you know, so that's just my 2 cents on that. I hope, you know, we need to analyze things carefully and not just make judgments. And again, none of the virologists that I've listened to, viral experts, we just do not have the technology yet to make something that specific. It may seem easy to you, but it really is very complicated. So the other thing was about the masks. You know, there's all this talk about the masks, and you know, the best mask out there is the N95. Now, what that means is that it only filters 95% of the stuff. Okay, it's not an N100. There's no N100 as far as I know. So you still have 5% of stuff going into your body. You know, the surgical masks. I mean, I don't know exactly where they are. They're probably maybe 70% effective, and the cloths can be anywhere from 0 to less than 70%. Depends on the type of cloth. So yes, you are getting some protection, but you know, just remember that all we're doing is reducing the number of infectious agents that go into our body. And you know, I don't want to scare you guys, but the reality is, for example, when you use a hand sanitizer and it says that it kills 99.99. Let me see, I have one here. It says, yeah, it kills 99.99% of you know, organisms. But you have to remember, bacteria grow logarithmically. So one bacteria becomes 2, 4, 8, 16, 32, 60. It just grows really fast. So, and they were talking to a microbiologist, and he said, well, after you sanitize your hand, that 0.01% that's left by the time you've sanitized your hand is already at 1 million. Okay, count. The other thing, you know, when I scrub my hands, you know, obviously I put sterile gloves and gowns, so I'm protected. But we also prep the patient's skin. Does that mean that skin is sterile? No, it's not sterile. There's still bacteria on that skin. All we're doing, we're reducing the number of bacteria that gets into that body, and the number is small enough that a person with a non-compromised immune system can fight those off. The only way for me to sterilize a patient is to put him in a sterilizer, which will cook him down to bone, okay, or expose them to ethylene oxide. So if we want to sterilize, let's say plastic would melt in a sterilizer. We use ethylene oxide gas, and it's toxic. I mean, it will kill us. So you know, you know, this is just to reduce the number of bacteria. And again, if you're immunocompromised, if you have diabetes, which is out of control, you really need to get that under control, okay? Because your body's not going to be able to fight the infection. You know, when we get a paper cut, you have millions of bacteria getting into the cut, but we rarely need to see a doctor. So, you know, just remember that. Again, control the things that you can control. Anxiety comes from a lot of times worrying about things that we have no control over. And again, that's not good for your immune system. So, well, at least, you know, there's some good news. Looks like we are beginning to reduce the number of cases everywhere. Let's just keep it up. The sooner we get rid of this thing, the better. This virus is probably going to stick around and become seasonal, so just be aware of that. And then hopefully we'll have a vaccine by then. All right, take care, be safe. I'll talk to you later. Thank you.